Okay, let's start up first with a story that is of essential importance. We're talking about the critical issue of heart health. As we told you a little while earlier, World Heart Day is this Sunday, September 29th. The heart, as we know, is often called the lifeline of the body. Yet heart disease remains one of the leading causes of death across the entire globe. Even with all of the advancements we see and regularly talk about on the Breakfast Club in medicine, fitness trends that we talk about, we still see a troubling rise in heart-related conditions. And what's more, physicians warn that in India, Indians actually suffer heart attacks 10 years earlier than Westerners do. This is a statistic that came out a few months ago. They say it's because of an earlier onset of cardiovascular disease, or CAD. CAD-related deaths and disabilities have reportedly doubled in India over the past 30 years. So, the question is, what can we do differently to keep our hearts ticking? Where are we going wrong? And how can we take care of our hearts and the hearts of our family members?
So today on the show, we are going to take a deep dive into all the steps we all can take to keep our hearts in really good shape with some of the country's top heart experts. But before we go ahead and try and get all those answers, here's an interesting story that emerged. This is a story which is of absolute brilliance and heroism and also quick thinking that came from knowing how to administer CPR. Do you know how to administer CPR? We've all seen that in movies, in videos, etc. But when the time comes to actually make it happen, the simple act can save lives. And this is what this heart hero actually looks like. Let's pull that video up on the screen also for you. A few days ago, a ticket examiner gave a new lease of life to an elderly passenger who was having a heart attack in a moving train in Bihar. What you see on your screen in those slightly blurry pictures over there, because we don't want to give away the identity of the person, is the TT actually going ahead and administering CPR. And because of that, because of Sarvinder Kumar, the TT of that train's efforts, the man was actually saved. So we're very glad to have Sarvinder ji with us on the program this morning to tell us more. Sarvinder ji, नमस्कार, हमसे बात करने के लिए बहुत बहुत शुक्रिया. पहले हमें बताएंगे कि उस दिन हुआ क्या, कैसे आपने डिसाइड करा कि अब CPR देना है और कैसे ये खबर आई आपके पास. And he's clearly man on the job because he's still on the train as you speak.
मेरी ड्यूटी गाड़ी संख्या 11062 पवन एक्सप्रेस में मुजफ्फरपुर से बनारस तक पहले इसकी सूचना 139 पे कंट्रोल को दी चुकी थी रेलवे को. तो फिर उधर से हमको कंट्रोल द्वारा मैसेज आया कि आपके को एक व्यक्ति का तबीयत खराब हो गया, आप जाकर उसको देखिए. तो जब हम गए तो उनके सहयात्री हमको बताया कि मेरे साथ मेरे भाई जो है ऐसे थे, सोए थे. हमको लगा ये सोए हैं, लेकिन इनकी जो कुछ ये बोल ही नहीं रहे. फिर मैंने कंट्रोल को सूचना दिया कि इनका तबीयत ज़्यादा खराब है और इनको जो है डॉक्टर उपलब्ध करवाइए नेक्स्ट स्टेशन पे. ठीक. तो तब तक वो क्या हुआ कि अपने रिलेटिव इधर उधर फोन करने लगे. तो उनके फैमिली डॉक्टर थे, तो उनके भाई के मित्र डॉक्टर थे, उनसे बात हुई तो वो जो है वीडियो कॉल पे बताए वो तो कि इनको जो है हार्ट अटैक आ गया है, इनको जो है CPR वगैरह करने की जरूरत. कि हम लोग को मंडल स्तर पे CPR की ट्रेनिंग दी जाती है. तो वो जो है डॉक्टर के उनके फैमिली डॉक्टर के दिशा निर्देश के अनुसार जो है हम लोग उस तरह का किए और उनका जो है सांस पुनः वापस आ गया.
We do want to just tell our audiences, Sarvinder ji is joining us, as you can see, from a train, which I think is why the connection is so spotty. But Sarvinder ji, हमें ये भी बताइए, जिस पैसेंजर की जान आपने बचाई, सब वो कैसे हैं अभी, आपको पता है?
तो उनका मैम हम नंबर नहीं ले पाए थे, समझ गए ना.
All right. So, Sarvinder ji, I hope आप हमें सुन पा रहे हैं. उस समय जहन में क्या चल रहा था आपके जब आप CPR दे रहे थे? Obviously ये मूविंग ट्रेन है, तो ऐसा नहीं है कि स्थिति एकदम से ठीक हो सकती है या फिर आप डॉक्टर से तुरंत एक कांटेक्ट कर सकते हैं. उस समय आप ही को करना था जो करना था. तो उस समय क्या चल रहा था जहन में?
वो देखिए, हम तो मेरा जो प्रोसीजर है अब कंट्रोल को सूचना देना, वो मैंने कंट्रोल को सूचना दे दिया कि इनको डॉक्टर उपलब्ध कराएगा. ठीक. तो उनके जो सही यात्री थे वो अपने फैमिली मेंबर में इधर उधर कॉल करने लगे. उनके भाई के मित्र जो डॉक्टर थे वो जो है कि वीडियो कॉल पे बता रहे थे इनको हार्ट अटैक आ गया, इनको सीपीआर कीजिए तो है ये पुनः ठीक हो जाएंगे। तो हम जो इस चीज़ को सुने और हम जो है हम लोग को चूंकि मंडल स्तर पे सीपीआर की ट्रेनिंग दी जाती है, तो सीपीआर का प्रोसेस पता था कैसे करना, तो वो किए और उनका जो है सांस पुनः चलना शुरू हो गया।
समिंदर जी, आज हम इस चीज़ पे बात कर रहे हैं कि सीपीआर का क्या महत्व है, सबको सीखना चाहिए, क्यों सीखना चाहिए, इसके बारे में बात कर रहे हैं। आप हमें बता सकते हैं आपकी ट्रेनिंग कैसे मिली? आपको सिर्फ टीटी को मिलता है, सारे ट्रेन स्टाफ को ये ट्रेनिंग मिलता है सर?
नहीं, हर स्टाफ मेंबर को दिया जाता है, जो पब्लिक से जुड़े हो उन सबको दिया जाता है।
ऑल राइट, थैंक यू सो मच हमसे बातचीत करने के लिए. That was the TT who actually saved somebody's life on a moving train.
Right.
And kudos to him to having done that and being so quick on his feet even when the doctors could not be contacted, and he had to do his bit and a life got saved. That's how critical it is. But let's take this discussion on heart forward. Joining us next is Dr. Vinod Sharma. He's the president of the National Heart Institute and he joins us this morning. Good morning.
Good morning.
Dr. Sharma, so lovely to have you on the program.
Good morning.
You know, as the World Heart Day, good morning. As the World Heart Day actually approaches, there are so many questions one has in mind. Can I just start with the one that bothers so many people today in India, which is the average age at which heart issues begin to appear? You know, there's a running joke in people in their 30s and 40s these days that if you've survived between 30 to 50 without a heart ailment, then perhaps you will go on to have a really long life. But that critical window is extremely important. Could you shed more light on that?
If we look at the profile of the Indian patient, no doubt compared to the Western population, Indian people are getting heart disease at early age. Obviously, it is because of the rising number of risk factors. If we look at the various risk factors, diabetes, obesity, stress, smoking, hypertension, they all are rising. And obviously, it is due to rising social pressure, work pressure, peer pressure, they are all building up. And as a result, the prevalence of heart disease in Indian continent is rising very steeply.
Doctor, can we ask you, compared to, because part of the statistic we shared with our audiences right in the beginning of the show was also that compared to Westerners, it's coming 10 years earlier here. But Westerners are also seeing stress. They're also seeing rising, for example, smoking levels. What is India doing? Is it a genetic issue also that we have with us? What's happening there?
There are two issues. One is of course genetic issue, and second is on one side we have rising risk factor, but adoption of so called healthy heart behavior, that is not there. The two are not matching. People are not engaging in the regular exercise. People are very careless about the dietary behavior. The smoking prevalence is rising. So, on one hand the prevalence of heart disease is rising, on the other hand the so called adoption of healthy heart behavior is diminishing.
Okay.
Okay, so Dr. Sharma, then the question really is this: if you are, and in India it's so relevant here, if you have genetically in your family a lot of heart diseases going in, are there certain kind of tests one must undergo to remain proactive, to ensure that the heart is in a healthy state? Are there some symptoms perhaps that can tell you that you need to do something about it?
There are two aspects. Of course, those people who are having multiple risk factors, say like family history, parents have heart disease at the age of 50, 55, or siblings have heart disease, person is diabetic, overweight, or is smoking, then these are the people who should keep undergoing medical examination so as to detect the heart disease at a preclinical stage before it gives symptom. Number two, as on today, if I say that looking to various modality of investigation of heart disease, whether it is a non-invasive or even the invasive, you cannot predict 100% that this patient is going to have heart disease, heart attack. If we look at nowadays, many people go and get CT coronary angiography. Now, CT coronary angiography demonstrates
Yeah.
40, 50, 30% block. Now, this 30, 40, 50% block of course has to be treated by their lifestyle modification and with some of the medication, but none of these medication guarantee you 100% prevention of heart attack. Suppose there is a block in artery 80-90%, and if we do the angioplasty, stent or bypass surgery, that does not take away the chance of sudden cardiac death. Yes, it does reduce ischemia, means it does improve blood supply to the heart muscle, and chances of chest pain etc. will be less, but still certain behavior, electrical behavior of the heart, so called electrical aberration, which lead to the cardiac arrhythmia and sudden cardiac death, that still can occur. So, focus should be there to grow towards controlling the risk factor. So, prevent the disease and whatever thereafter we can do for medical side for introducing the drug or doing any procedure.
Very important point, yeah.
Doctor, just highlight for our audiences, because I also want them to have a concrete takeaway. Tell us do's and don'ts for a healthy heart.
See, if we look at the what is do for the healthy heart, there is a very simple mnemonic one can remember: A, B, C, D, E. A for HbA1c. In India, every fourth person is diabetic or going to be diabetic because of their lifestyle. So, first is HbA1c, A stands for A1c, HbA1c, that is mean glucose, that has to be kept well under control below 6.5. B stands for blood pressure, timely measurement of blood pressure, and blood pressure has to be kept below 130/80 and preferably around 120/80. C is for two C's, one is cholesterol. One should look at the cholesterol lipid profile specifically towards the bad cholesterol, that is LDL, and very typical value is one should keep it below 100, and if someone is diabetic also keep it below 70. Another C is cigarette, is smoking, that should be forbidden totally. Next is D, diet, low fat balanced diet, low fat moderate carbohydrate high protein diet, and E of course is exercise. One should engage in a regular exercise for 45 to 50 minutes, moderate in intensity, at least 3 to 5 times in a week. If one follows this, he can prevent the heart occurrence of the coronary artery disease to a large extent.
Okay, I see. Important points there, and by the way, brilliant visuals on screen as well right now for people to actually understand what happens when your arteries get blocked. And there is nothing that can remove the blockage. All you can do is thin your heart, or you can do other mechanisms to make it healthy. That's what the doctor is saying. You know, don't let that situation occur in the first place. But Dr. Sharma, very curious about understanding the different kind of cardiovascular diseases that emerge in men versus women. The cases of heart attacks as well, much more in men. Why is that?
Well, if we look at the difference between men and women, of course, the prevalence of heart disease is more in the men. If we look at the total risk factor profile and comparing between men and women, risk factor profile is much more in the men. Men are more smoker. More men you will find sedentary, more men you will find obese, more men you will find high blood pressure. On the other side, women also have diabetes, high blood pressure, obesity, but till the age of the menopause, they have a protective arsenal, that is the estrogen, that protects them from the heart disease. Premenopausal women will get heart disease only in 3 odd situations. If she happen to be diabetic, if she is consuming oral contraceptive, or if she is a smoker. Otherwise, it is very rare to get a premenopausal women to have a heart disease. Now, when the heart disease occurs in the women, the another problem is their symptoms are atypical, and more often it is being ignored. If we look at the male population versus female population and the timing of picking up their heart disease, it is quite a wide difference. More often women neglect this symptom as a usual symptom. I have been working whole day, so I am feeling exhausted, but this undue exhaustion may be a symptom of heart disease. Similarly, vague chest pain, vague abdominal pain, back pain, which may be really a manifestation of coronary artery disease, which a particular women may be neglecting, thinking it is just because of the overworking or tiredness. And more often they try to wind up with this symptom without bringing it to the notice, because they are more committed toward their household chores.
Yeah. Doctor, tell us, right there to that question, we talked right now about premenopausal women, but I do want to ask, I had an aunt who recently felt like she was having heart attack symptoms taking place in her body. And it's at that moment that we realized, and when we Googled it, that what looks like the oncoming of a heart attack for a woman, especially of that age, can actually be quite different from the symptoms we say for a man. What are the differences? Can you just tell us, especially for the audiences watching?
See, some of the symptoms which are taken as routine and forgetting that it may be a cardiac symptom are, say, like stomach pain, the lower part of the chest and upper part of the belly discomfort, or feeling of a kind of so-called acidity. That acidity may be really a sign of a heart attack, or a pain in the back, center of the back, pain in the neck sometime, profuse sweating, sudden breathlessness, undue fatigue. These are very common symptoms which kind of mixes with the routine thing. So, these are so called atypical symptoms which are more often seen in the women, and that is how they miss the diagnosis of heart attack, because they do not get the medical attention, they do not bring it to the notice.
Yeah. Actually, this is to say that heart attacks don't really happen how we've seen in the movies, that somebody gets pain in the chest and they collapse. Oftentimes, it's because you're profusely sweating. A lot of people actually run to the loo because they feel like there's pressure building up in the body, and the body is basically trying to, you know, sort of fight it out. So there are different ways, but the minute you feel something out of the ordinary, I think the basic thing in a heart attack is to rush early, because if you're late, that's when recovery is much harder. So watch out for these symptoms and get in touch with the doctor as soon as possible. But before we let you go, Dr. Sharma, a lot of these days, a lot of gadgets are doing the rounds. There are ones that get attached to your body that is constantly tracking your, your blood pressure, your glucose index, etc. There are watches that give you a hint of what your BP and the rest of it looks like. What is your take on all these gadgets? Do they help? And if yes, how?
If we look at the gadgets and their utility in our day-to-day use, and in terms of picking up the heart disease or cardiovascular disease, I would say broadly, it is their usefulness is yes also and no also. Yes, in the sense, yes, one can monitor the heart rate, one can track the heart rate, especially if the heart rate is fast and irregular, and person is feeling a symptom in form of palpitation or so-called ghabrahat. But all the time the heart rate which is shown, it cannot be a marker of a disease. Number two, these technologies like a smartwatch, they are basically, their basic mechanism is a photoplethysmography. So, there are a lot of chances of false positive with them. As far as a smartwatch is concerned, yes, the situation where it is useful is person who is getting intermittent, time to time irregular heartbeat, which is fast, that is called as atrial fibrillation, which can precipitate a stroke any time. Many a time we are not able to diagnose, because when he comes to the hospital, his heart rate is normal. So, in that patient, probably the smartwatch may help. Similarly, the blood pressure monitoring instrument, yes, it is good to monitor the blood pressure at home, provided the cuff is applied properly and it is monitored in a proper time. It is good, because if we compare the blood pressure monitored at home vis-a-vis hospital, in hospital there is something called white coat hypertension. Whenever they reach hospital, anybody reach hospital, their blood pressure goes up by them. So, home blood pressure monitoring is always better predictor. Blood glucose, yes, it is a reasonably accurate. So, most of these apps which are there, instruments which are there, they are really good, but at the same time they cannot be taken as a gold standard to pick up heart disease. And if we talk in terms of the heart disease, it is more of a heart attack. So, the smartwatch depicts only one ECG lead, and to diagnose heart attack you need comprehensive 12 leads. So, yes, if you are finding sudden change in your heart rate, coupled with the symptom like chest pain, breathlessness, better to go to the nearest medical facility.
Dr. Vinod Sharma, thank you for joining us. Thank you for laying out all of the basics for us, even telling us a smartwatch good, but not enough to track your heart health. Go in for regular checkups. Doctor, thank you for joining us this morning. We're not done in our deep dive of the heart. Next, we have an interview with Dr. Rahul R. Gupta. Why we're highlighting him? He's from the Apollo Hospital and he speaks about a recent case where he performed a TMVR on a 69-year-old patient. A TMVR is a minimally invasive structural heart disease treatment. It is usually done to replace a damaged valve within open heart surgery. Take a look.
I guess so. Sir, could you tell us about what this new modality is? How is it different from the open heart surgery, and how does it help patients who are of a higher age limit?
So this 69-year-old female, she already had 2 open heart surgeries for repair of one of his valves. So we have 4 valves in the heart, and one of her valve, which is mitral valve, was damaged. So it was repaired, then again with the open heart surgery it was replaced with a new valve 10 years back. That was a surgical replacement. Now she again came with problems of breathlessness, and when we did the echocardiography, which is the sonography of the heart, we found that the valve has again become defective. So she needed another valve replacement. Now the question was that whether the third surgery is safe, open heart surgery is safe, or should we offer her this innovative therapy which is called as TMVR. And we discussed in the heart team with all the surgeons around, and they took multiple opinions, and they found that open heart surgery third time would be really risky. So we were in a situation that what should we do for this patient when they approached us. So then I suggested them TMVR. Now TMVR stands for transcatheter mitral valve replacement. So you can actually replace any of the heart valves without open heart surgery through these innovative technologies, where you just like people know about angiographies and angioplasty, we do it through either hand arteries or the leg arteries under local anesthesia without any chest cut on the chest and opening the heart. So we did the same procedures for her, and we went through the leg vein. We reached the heart, the designated the place where we wanted to reach the mitral valve, and then we put a new valve. This procedure got over in about 1 hour's time, and patient was actually ready to go home within 24 hours. So we usually discharge the patient within 24 to 48 hours, and she is doing extremely well. So I think these procedures are very important for people to know that such kind of innovations are already there, where patients who are at high risk for surgery are at advanced age. They feel that this is going to be very risky. So instead of suffering and with the fear that surgery, something might happen to them during open heart surgery, and living in misery, they can undergo and they can adopt these innovative therapies, and they can do really well.
So sir, like you were mentioning about TMVR, how is it different from angioplasty, angiography, or open heart surgery? For the betterment of our viewers, because they would not really understand what TMVR is, if you could differentiate all of that so that they understand.
Correct.
Better.
So the difference here is between the valve replacement through open heart surgery versus without open heart surgery. Angiography and angioplasty is for the blockages in the heart. When people develop heart attack or when they develop chest pain and all, when we find blockages, we remove the blockages find out the blockages through angiography and remove the blockages via the procedure called as angioplasty. The surgical counterpart of angioplasty is bypass surgery. Okay, so this is a separate vertical. Now if we look into the valvular problem, there are 4 valves as I told you. Now in a typical open heart surgery, the person has to undergo the cut, open the chest, stop the heart, replace the valve. Patient stay in the hospital is 5 to 7 days based on which route we have used, minimally invasive or the central open, and then there is a prolonged ICU stay as compared to a transcatheter procedure. While in TMVR or these transcatheter procedures, we can do all these under local anesthesia. ICU stays hardly for 24 hours, and then if needed, 1 day in the ward and they can get discharged. Most of these transcatheter procedure can be done under local anesthesia, or even if they need a general anesthesia, it's a very short GA. So no cut, no incision, patient goes home just like if nothing has been done, and they are back to work immediately after discharge. So there is no waiting period for recovery and all. So that's the beauty of these innovative transcatheter procedures, and people should know about it. That's the only message which I want to give on this World Heart Day, that there are procedures for all those people who are at high risk for surgery and they are advanced age where they are fearing surgery. They need not live in the life of suffering. They can get their valve treated with these innovative procedures.